Hi everyone. Today we are going to talk about preeclampsia, hypertension during pregnancy. My name is Carlos. First, hypertension during pregnancy. When we consider like the patient is hypertensive is when the blood pressure is more than 140 over 90. Also, because we are in pregnancy, we need to divide. If the patient is less than 20 weeks in pregnancy, we consider this as a chronic hypertension. If the patient is more than 20 weeks and less than 6 weeks postpartum, we consider either gestational hypertension, but if the patient also has proteinuria, we're going to diagnose as preeclampsia. So preeclampsia, what is the risk factors for preeclampsia? Being the first pregnancy, multiple gestations, advanced maternal age, such as the patient is too old or too young to become pregnant, obesity, or pre-existing condition such as chronic hypertension, diabetes mellitus, certain autoimmune diseases, of renal problems. Preeclampsia. We have to divide preeclampsia into mild and severe. For what this is important is because the treatment varies according if the preeclampsia is mild or severe. Mild preeclampsia essentially is the blood pressure more than 140 over 90. We also gonna find like proteinuria, but in the deep step only 1 or 2 crosses, or 300 milligrams in 24 hours urine recollection. When we consider the preeclampsia is severe, the blood pressure is more than 160 over 100. The proteinuria is in the deep state 3 and 4 crosses, or in the 24 hours urine recollection we find 5 grams of protein, or the patient is presenting with warning sign. Warning sign meaning the patient is the blood pressure cause and organ damage, such as headaches, visual changes, epigastric pain, pulmonary edema, oliguria, urea of more than 1.1 milligrams or 2 times the normal value, increased liver enzymes, or thrombocytopenia, meaning less than 100,000 platelet count. The treatment for a hypertensive patient, especially a preeclamptic patient, we first need to know which drugs are okay in pregnancy and which drugs are not okay. Okay in pregnancy: labetalol, hydralazine, methyl-dopa, and nifedipine. Nifedipine is the only one per mouth. The other one are IV. Don't use ACE inhibitors, direct renin inhibitors, ARABs, nitroprusside, or spironolactone, or all the similar classes. We're gonna only treat a hypertensive patient when the blood pressure is more than 160 over 100. Why is that? Because we don't want to decrease the flow, the uteroplacental flow that is going to affect the fetus. The goal is those values, 140 and 150 and 90, 100. So we also have to recognize what is the ultimate treatment for preeclampsia is delivery, because if you take out the baby, you don't have a preeclamptic patient. Delivery, when we consider delivery, is more than 30 weeks of the patient presents with severe features. Actually, as everybody knows, 34 weeks is before that we need like long the fetus need like a long maturation of the lungs. So that is why like If the patient doesn't present with severe features, we can continue the pregnancy until 37 weeks. One of the complications of preeclampsia is HELLP syndrome. HELLP syndrome stands for hemolysis, elevated liver enzymes, and low platelets. What the risk factor of HELLP syndrome is a previous history of HELLP syndrome in previous pregnancy or family history of this syndrome. How we diagnose this is with the CBC or CMP that we are going to see here. Hemolysis, signs of hemolysis, for example, increased LDH, elevated liver enzyme, and low platelet count. What is the treatment? The treatment is immediate delivery. But when we use that, when it is more than 34 weeks, fetal distress or maternal disease. What happens if the patient is stable and there is no fetal distress and the pregnancy is less than 34 weeks? We can continue the pregnancy, but we have to make sure like we initiate a good control of blood pressure, and also we initiate magnesium sulfate for seizure prophylaxis. What is the complication of HELLP syndrome? The patient can go into eclampsia. Eclampsia again is a seizure in a preeclamptic patient. ARDS or DIC. DIC can be fatal, and the patient can die for a complication of HELLP syndrome. This is a pretty dire situation. Again, another complication is eclampsia. Eclampsia is essentially in the preeclamptic patient, a preeclamptic patient present with seizures. What we need to know is the treatment is magnesium sulfate, IV. Also, we need to know like what happens when the patient is present like with. We have to recognize where the toxicity of the using this medication is. We're gonna have a hyperreflexive patient, respiratory distress, and we also can have like cardiac complication. That's why the treatment of toxicity is stop this magnesium sulfate and administer IV calcium gluconate bolus because of the cardiac complication. So this is basically an overall view of preeclampsia. Again, in a nutshell, we are gonna say the hypertension during pregnancy is more than 140/90. It is less than 20 weeks. We are gonna define this as chronic hypertension. It is more than 20 weeks gestational. If the patient presents with a protein in the urine, we're gonna call it preeclampsia. We have to divide mild and severe. Severe is a BP more than 160/100 and proteinuria. 3 and 4 crosses in the dip stick, or 5 grams in the 4 hours, 24 hours urine collection, or the person presents warning signs. What is important is because the treatment, because what is the ultimate treatment is delivery. But if the patient presents with severe features or is more than 37 weeks. Why? Because we need to keep the baby as long as we can inside of the uterus in order to have the lungs mature enough. What is the complication? Essentially two main complications: HELLP syndrome and eclampsia. HELLP syndrome stands for hemolysis, elevated liver enzymes, and low platelets. What is the treatment for that? If the patient is more than 34 weeks or there is a fetal distress, maternal kind of disease. What is the complication of HELLP syndrome? This is a pretty dire situation: eclampsia, ERDS, and DIC, acute respiratory distress syndrome. By the way, and eclampsia is a preeclamptic patient with a seizure. How we treat it? With IV magnesium sulfate. So this is all. Thank you for watching, and I'm gonna come back with a new video.